Hi, my name is Adrian, and I am here to listen to Mary's speech today.
Hi, I'm Ellen, and I'm here today to hear Mary's presentation. Good luck.
Hello, my name is Leslie, and I'm here today to listen to Mary's speech.
Thank you, everyone. I'm Mary, and I really would like to thank you for giving me the time. I know everybody's time is very precious, especially on a Saturday afternoon. Hopefully, in the next 10 minutes, I will give you some information that can possibly save someone's life one day. I'm a registered nurse. I've been a nurse for almost 40 years, and I've worked in the ICU and the emergency room most of my career. I'm also a recovering addict. I was introduced to painkillers back in 2000 when I injured my shoulder, and that caused me to go down a long road of a lot of misery. But it also gave me the experience that I can talk about this problem professionally and also personally. The opioid crisis. Just like to talk about that for a second. That didn't just start, it's been going on for many years. Heroin addicts go back as far as the late 1800s. Heroin was first introduced as a cure for morphine addiction by the Bayer Company, Bayer Pharmaceuticals. Bayer Pharmaceuticals came up with the name heroin because when they gave it to patients, the patients felt heroic. Who doesn't want to feel like a hero? And the name heroin came around. Little did they know the problems it would cause many years down the road. So people like Billie Holiday back in the 50s, she was a famous blues singer, died of heroin, drugs, and alcohol abuse. Also, Chet Baker, a famous jazz trumpist, he died of heroin and cocaine abuse in Amsterdam. And this has been going on for so many years, but I hate to put it this way, but you know what? People didn't care when it was in the inner cities, when it was affecting blacks, jazz musicians. Nobody really cared. Now that it's come out into our counties and it's affecting our children and it's affecting everyone, now there's an epidemic and we have to do something about it. According to the National Institute on Drug Abuse, in 1999, there were over 16,000 deaths from heroin abuse in our country, or opioid abuse in our country. And in 2000, that has increased to over 70,000 deaths nationwide. In our state of Maryland, 1,100 people died from January 2018 to June 2018 of narcotic overdoses. That's a 14.8% increase from 2017, so it's constantly on the rise. Public officials are doing a lot of analyzing and trying to fix this problem, and they have a long way to go, but that's not what I'm here to talk about today. What I want to talk about today is how we can save lives, and that's with the use of Narcan. Narcan comes in a very small, as you can see, it's like the size of my hand, container, and this little dose that you can get at any pharmacy now, without a doctor's order. There's a standing order all over the country, except there's a few states where they still have not approved a standing order. That's Delaware, Massachusetts, and a couple states out in the Midwest. But any pharmacy, especially CVS, you can go in and ask for Narcan and they will give it to you for a small cost. So this little dose here can save somebody's life. The first thing, you need to be able to recognize what is an overdose. And an overdose is loss of consciousness. If you see someone who is unconscious, who doesn't respond to their name or shaking, and you know that they take narcotics or are an addict or a recovering addict, and they will not respond by shaking, this is a loss of consciousness. Shallow, irregular breathing, that's also a sign that the person is overdosing. Pale skin, blue fingernails, a bluish tint to their skin. This little dose here, inserted into each nostril and then a little push, can save that person's life. It's also important to know that this is not a permanent solution. You need to activate the emergency medical system. You need to call 911 or have somebody else call 911. This will only last for about 30 to 90 minutes, and then the person, if they still have drugs in their system, will start to overdose again. In 2015, the American Heart Association actually introduced an algorithm into basic life support. So now anyone being trained, you don't have to be a medical professional, any layperson being trained in basic life support will receive training on Narcan, how to administer it safely, and how to recognize an overdose. This is a big step for our country. In April 2018, there was an article in the American Emergency Medicine Journal, and it was written by Harvard professors and teaching at the Harvard Medical School. And they wrote an article, and it was called Rescue Part of Basic Life Training for Medical Students, How to Incorporate Narcan into this. And they did this hoping to increase awareness and take away the stigma of narcotic and overdoses. This was helpful, and they found that they went to the American Heart Association, and the way they described it was that, cardiac arrest typically results from an underlying chronic illness, coronary artery disease. And like coronary artery disease, addiction is a chronic disease, and with acute life-threatening exacerbations known as overdoses. And coronary artery disease yields from changes in the coronary artery vasculature, predisposing people to cardiac arrest. Addiction is mediated by changes in the brain. Still, both are chronic illnesses and should be treated as such. The increased deaths caused by decreased availability of prescription painkillers now, and the increased availability of heroin. Heroin is also very inexpensive, and the prescription painkillers are very expensive. There is only one drug that can reverse an overdose, a narcotic overdose, and that drug is Narcan. Narcan was discovered back in the late 1800s. They were actually trying to create a drug to prevent constipation from narcotics, and they accidentally came across this drug that attached itself to the opioid receptors. And it was first introduced back in the early 1900s and was found to reverse the effects of overdoses given IV or intravenously or intramuscularly in the hospital. Back as early in the 1990s, the government, according to the Center for Disease Control, saw that the opioid crisis was coming, and they needed to have a way that the layperson could administer Narcan safely. So in 1996, Washington, D.C. and 15 other states actually had a pilot program where they gave people Narcan spray to take home and use, and found that that was very successful. So there is a standing order now in every pharmacy, and basic life support from the Red Cross or the American Heart Association will help you be trained for administration of Narcan. If you don't have the training, you can still go up to any pharmacy, get this. If you have an addict in your life, whether it's a child, husband, wife, or somebody on chronic pain medication at home, you should have availability to this, because this life-saving measure can save somebody's life at least buy you time until emergency medical people are there to help you. And I'd like to thank everybody for coming today, and have a great day.